Generally, the index is now pointing towards her right shoulder, very similar to where your index points in peristernal long. So you're going to clip store here. We can see both aortic and mitral valve here. That's our goal. If you're having a hard time, I know this can be kind of tricky, you keep on turning. If you feel like, and if you turn too much, I've over rotated. Now I'm almost pointing towards like her elbow. You lose the mitral valve. If you get lost, go back to 4. To me, that's my recommendation. If you get lost and you have no idea where to turn, where to go back to a 4 and rotate back through. That's my recommendation. That's what I do. So you're going to clip store here. You're going to show color across. How do you feel about them doing it both, over both?
If you can fit them in there, I think it's fine.
If you can fit it in there, yes. Now, if my patient had significant aortic stenosis or aortic regurg, I'm very commonly going to focus just on that aortic valve. But if you can include them both without making your box huge, you should be good. You're also going to put, so you're going to clip store here, you're also going to put color across your interventricular septal wall. We're still looking for a VSD shunt. This may be your best window for it, you never know. So you've got to include color over your interventricular septal wall. You're also going to go back and put pulse wave here in your LVOT. You don't have to measure anything here. You're just looking for any velocities that may be at a better angle that you may can capture and get them higher. So you're going to image store your pulse wave at your LVOT, and you're going to do the same with your continuous wave. You're not transiting anything. You're not measuring. Just store it. And I believe that is it for apicals. Any questions? Does that make sense? Yes, I know it's a lot. So now I'm going to let you lay it back. So now we will move on to subcostal. We're going to start in a 4 chamber here. So index is very similar to how we did an apical, how it was kind of pointing towards the bed. I'm going to kind of point it towards her left side, towards me. Let's see. So you can kind of tell how I'm kind of tweaking the settings. I'm going to move my focus. I'm going to move my depth. A lot of times you're going to have to increase your depth. So take a deep breath and hold your breath. So you would image store here. You can breathe. So you can tell when I first got my image, I was increasing my depth. As she took a breath in, you're going to make sure that you're going to adjust your image how it changes. So take a deep breath and hold your breath. So I'm not going to have my image look like this. You've got to bring that depth in because now your focus has changed. So this would be a pretty good 4. You can breathe. So you're going to clip store there. So here we're also going to put color over. So you don't have, okay. So it looks like protocol, y'all are going to put color over your tricuspid. So take a deep breath and hold your breath. So color, you can really see that tiara jet there. Color over the tricuspid valve. You're going to move and put color over the interatrial septal wall and also over the interventricular septal wall.
Did we do that in 4 chamber?
You can breathe. We did do this one, the checkoff.
No, on the protocol. Do we have that?
No, did I miss that?
I don't know. I need to add it if it's not in there.
You know what? I double checked it too, and you are 100% correct. Did I miss it?
I don't know that it's in there.
I don't believe it is, but it does. It does need to be in there. I'll go back and show. I know it's a lot, but I'll go back and show that because I'm not sure if that's on their assignment sheet today. Okay, so take a deep breath in and hold your breath again. When you're looking for color over the interatrial septal wall, if you see a 5 chamber or you see aortic valve, then you're truly not across the interatrial septal wall. So make sure you kind of angle back down, similar to what you do with your 4 chamber. This is true interatrial septal wall. This is not, because that's aortic valve. You can breathe. So make sure if you see that quote 5 chamber, you gotta angle back down. And you can tell even though she's very photogenic, I'm getting her to take a breath every time with her subcostal. I'd say 99.9% of the time you're gonna have to do that. So just remember when you're trying to do your subcostal, if you can't see, always get them to hold breath. All right, where are we? You can also, how we saw her TR jet, you can put a continuous wave Doppler across the tricuspid valve to get a TR jet if you can measure that a little bit better. I would have easily done that. If that was her best window, put your continuous wave and measure. All right. Oh, hold on. I think I said that. Let me go back. But you could do that. Not that that's part of your protocol. Here I am. Okay. Okay. So say we got to her short axis windows. Started peristernal. She had an okay peristernal window, and we could not see short axis at all. This is very common, especially like COPD patients or patients that have some lung troubles. Sometimes you won't get a peristernal or a short axis window at all. You can turn your index, so think about kind of like what you would do like sagittal. Your index is going to point towards the head, so take a deep breath and hold your breath. And you can actually sweep through your short axis windows. So apex, so I'm going to lean really far over, so I'm sitting sideways really far over to the left, my cord's leaning towards her right side, and I'm going to slowly bring it back towards me. You can breathe. And you can actually sweep through the left side of the heart, very similar to short axis, and you could obtain those windows. I do this often. So just know that if you can't see short axis, go in subcostal and check. So now we're going to look at the IVC. To the image of the right. Okay, let me backtrack. Let me see where I'm at. Obtain to the image of the IVC. Okay. So here I'm going to be long of the IVC here. So sniff your nose for me. See how it collapses? You're going to want to capture that. You're going to want to show the IVC with a sniff or when it collapses. If you're patient with a normal breath in as she's breathing normally, if it collapses, that's fine, but you've got to show that true collapse. Whether it be sniff, a deep breath, you've got to show it somewhere. So make sure you capture that. Do y'all measure IVC? You will. So you're also going to measure the diameter of your IVC here. You want to measure it generally at its largest, really close to where it enters in the right atrium. So here, that would be pretty sufficient. Try not to come here. Don't be this far. I mean, you're really far where the liver is. You want to be close to where where it's going to dump into the right atrium. If you were measuring here, let me find it. If you are measuring, if you're measuring somewhere right in here, that's part of the heart. So just be mindful where you are, because some of that you're almost like trying to measure right atrium. Then y'all have color. You can put colored Doppler across the IVC. Look for any like flow reversal. This is for patients that have significant tricuspid regurg. You can click store here. Some clinical sites, you'll actually see them put pulse wave in one of the hepatic veins here, and they'll just take an image. So that's very common, you'll see that. But y'all's protocol, you just do color. So I think that's pretty much it. Oh, so IVC. If I'm leaning a little bit more towards me, like sitting sideways towards her left side, like towards me, and you see this structure here, this pulsatile tubular structure, sniff your nose for me. That's kind of tricky. This is the aorta. It kind of looked like a collapse, but it didn't. But it didn't.
It just twitched.
Yeah. To me, the IVC has more of like a scooped look versus the aorta has more of an elongated, like very straight. If you see it as pulsing, that is the aorta. If you are on the aorta, lean a little bit more towards the right side. Because I'll see that a lot. A lot of y'all are going to measure this as IVC and make them do a sniff, and it's aorta all day long. Okay. Any questions on that? Any questions on subcostal? I'm going to go to Superstar, and then I'll go back to Apical.
Right the home stretch, guys.
Yes, I'm sorry, it's so much. It's just, I think it's because there's a lot.
But the good thing is y'all are gonna have this now in Canvas. You can look at it anytime you're studying the protocol. You can look back and see what we said.
So index is still pointing towards her head. Well, right now it is. So remember how we made a comment, and I think we talked about left shoulder. Sometimes your index can point a little bit like, right shoulder, like right ear area. Sometimes you do have to twist your probe just to get that full arch, like the ascending aorta and the descending. I'm pointing a little bit more towards her head, so just know to start one way, and you can kind of angle or tilt your probe just to get the entire, or it's separate. So I'm gonna angle here, and I'm gonna send sound waves towards her right shoulder. That's gonna be her ascending aorta here, and I can tell because of the color flow, it's coming up towards us. So it's coming up towards the probe, that's ascending. And do we remember what this structure was down here? I know we went over this a long time ago. Does anybody remember what that is? Yes, okay. So ascending aorta here, and then, so if this is ascending, I'm gonna lean my probe, so I'm gonna send it sound waves more towards her left side, and so the cord's gonna lean a little bit more towards her right, and this opens up aortic arch here, and this is descending. And when I put color here, it's going away from us. I gotta even look what I'm supposed to be telling you. So you're gonna do, make sure you do a clip store here. See, that's pretty, I can see ascending, arch, descending. If you have to take two images to show ascending and descending, that's fine, but you gotta show both. You've gotta have it some way, somehow. You're gonna do color, like we just did, you're gonna clip store color, ascending, and then usually your arch, you'll kind of include that with your descending. You're gonna clip store that. And then you're gonna do a pulse wave Doppler here in your descending aorta. See how we get aliasing? See how you get this coming across? Well, you can't see true peak, so you've gotta adjust either your scale, your baseline, press your I-scan button, even if you don't know, try that. What does it say here? You're gonna do a peak. Some of the machines, I know the Philips will have it, it'll say descending AOV max. If you don't have that, just put a cursor, put a point, something that's gonna show the max velocity there. Pulse wave, continuous wave. You can't do continuous wave, it's part of your protocol. If your patient has aortic stenosis, she does not. And of course, continuous wave if your patient had coarctation or any narrowing or tight areas through the descending aorta, which she does not. Just know that you can do that. And I'm going to show you one more thing. Anyways, that's just continuous wave if we had to. Let's see if I can catch it right here. I'm going to go back to 4 really, really quick because I kind of skipped.
It's not in their protocol, but we need to add it in the future.
Here, so I'm going to go back to 4, which I think we might have done this when we did y'all's check off. Somehow it just got slipped through the cracks with your protocol. You're going to put color across your I do that every time. Your interatrial septal wall here. We're looking for any shunting across the interatrial septal wall, whether that be like an ASD or PFO. You're going to clip store here, and you're also going to move. You're also going to put color across the interventricular septal wall. It's kind of an awkward thing. Just try to make sure your color box isn't like that. Try to elongate it the best you can to get as much of the interventricular septal wall that you can here. But remember, you're putting color in short axis. You really are showing that, so I feel like that would be pretty good. You're looking for a VSD there. You're looking for any shunting across that wall. So that would be a clip store. And I think